My name is Walter Ingram. I'm an internal medicine physician. I graduated from the Air Force Academy in 1992 and the University of Kansas in 2003. I'm also a 23-year Air Force veteran. I like internal medicine for its detail and its exactness. I like to figure out exactly what's going on with the patient and then coming up with a very specific treatment. Also, I like the idea of following up with patients and seeing how they respond to treatment. So I think those are the big things. I really like the attention to detail that comes along with medicine. I like to prevent disease from happening. I think the best way to cure a disease is to prevent it from happening from the very beginning. Now, obviously, that's not possible. You know, everybody's going to get sick of something. But if you can prevent something from happening, especially things like cancer, I'm very big into preventative medicine, and things like heart disease and diabetes. If you can not get diabetes in the first place and you can stave off all the adverse outcomes that are associated with it. So I'm big into preventative medicine. I see a lot of patients that are so fearful of, what is this medicine going to do to me? What is this treatment going to do for me? And I would encourage them to think about, I think they sometimes are more fearful of the treatment than the disease that they have, and that the disease that they have is by far more dangerous than the actual treatment, and that their physicians have taken into account the risk and the benefit of starting a medication, and that if we are recommending a medication or a treatment, we are making that decision based off of the fact that that treatment is far less risky than the potential outcome of that disease process. So I would just kind of ask them to somewhat be more open to treatment. If they're not ones to like to take medicine. I see a lot of patients say, well, I don't like to take medicine. I understand. Sometimes you have to. I think when your physician says, I understand, or I know where you're coming from, they honestly mean it. I can truly say I mean it, but also I really do know where my patients are coming from as far as dealing with illness. I'm a cancer survivor. I got diagnosed with leukemia in 2004 and got a bone marrow transplant in 2011 and had a lot of complications. And so I know what it's like to be a patient. And so my approach to patients is realizing what it's like to kind of go through some difficult medical situations. So I think that's what I would like my patients to know about me, is that I do know your situation, and I have true empathy for you, and that'll have a significant factor in how I care for you.